I'm Dushyant Sahani, professor of radiology. I'll share with you how I use spectral CT in assessment of response to liver-directed therapy in patients with hepatocellular carcinoma. This is the hanging protocol I prefer. On the top left, I have arterial phase monochromatic images reconstructed at 55 keV. These images provide a high contrast of lesion to background, in this case, between the lesion and the liver. On the right side is the venous phase images reconstructed at 70 keV in a soft tissue kernel. On the bottom left are the coronal images, and on the bottom right is the material density iodine images. So let's start. But we can go from the top of the liver. Now, first thing I would say is post liver directed therapy, there are many changes that happens that can deceive us on a conventional images. And our goal is to assess if the tumor has been treated. Is there a viable disease that might require retreatment? Or if there is additional lesion, that means disease has progressed and we might have to consider alternate options. So here, what you notice at the top of the liver on the monochromatic images is a lot of high density. Now the question is, if these are enhancing areas, which will be a bad thing in a setting of hepatocellular carcinomas. So here we look at this, we come down, we see some additional soft tissue changes in the liver, a lot of high density. We continue to see that. There are changes in the liver. We come down, we look at the vascular structures, we go down and look at the rest of the lesion. We find a tiny low density lesion. I don't appreciate obvious enhancement, but I will interrogate this lesion again later on. We can go on the venous phase images. What we noticed on these 70 keV monochromatic images, the density of the lesion in the liver, which is treated intraarterially, they remain similar. They are high density. That tells us more than likely, and this is not a viable tumor, this is something else. We go on the coronal images to look for the margins of the lesion, if there is any abnormal enhancement along the margins of the lesions. And I continue to appreciate the same high density in the liver. We will also look at the vascular structures like portal vein to see if there is any filling defect in the portal vein. I did not appreciate. There is a lot of atrophy or a volume loss in the liver. Now let's go and look at the material density iodine image. What you notice here is on the material density iodine image, that areas are higher density. Now we know on the material density pair, we are decomposing between soft tissue and iodine. But any material that is higher atomic number than iodine will also stand out as high density here. So the question is this enhancing lesion? This is related to expected findings on TACE therapy. What I will do is now I'm going to put a virtual unenhanced images next to the material density iodine pair. What I noticed, all the high density areas within the treated lesion remains high density on virtual unenhanced images. That confirms the finding. These are post-treatment changes. These are not enhancing areas. Now, when I put everything together, I feel confident that the interventional radiologists who have treated this lesion have done a great job. There is post-treatment changes. These are expected findings. There is no viable disease, and I haven't seen any additional lesions. Now let's go back and look at that tiny area we discovered on the initial monochromatic images. Again, on the material density pair, you notice that lesion is dark. There is no signal within the lesion. Now this also confirms my findings of this being a non-enhancing cyst in the liver. So let's put everything together. So in this situation, where there was a hepatocellular carcinoma treated with intraarterial therapy, combination of monochromatic images and the material density iodine pairs confirmed that this lesion has been treated well. There is no viable disease. The value of the material density water or virtual unenhanced images is emphasized on confirming the high density material, which is a non-enhancing areas related to TACE therapy. This is how I use spectral CT images in my practice to assess response to liver-directed therapies in the patients with hepatocellular carcinoma.